There's something happening to millions of people over 60 right now, and their doctors aren't warning them about it. It's not on the list of common side effects. It's not mentioned during your appointment. And by the time you realize what's happening, the damage might already be done. I'm not talking about a rare condition or some exotic disease. I'm talking about something so common, so widespread, that it's hiding in plain sight. And the worst part? It's often caused by the very medications that are supposed to help you. Let me tell you about Margaret. She's 72. Always been sharp as a tack, active in her community, remembered everyone's names and birthdays. Then over the course of about 6 months, she started forgetting things. Little things at first, where she put her keys, what she went to the store to buy. Then bigger things, appointments, conversations she'd had just days before. Her family started worrying about dementia. They took her to specialist after specialist, ran tests, brain scans. Everything came back normal. Nobody could figure out what was wrong. Until one doctor, just one, asked a simple question. "What medications are you taking?" Margaret pulled out her list. Blood pressure medication, a statin for cholesterol, a proton pump inhibitor for acid reflux, a sleep aid, an antihistamine for allergies, and a couple of others. 7 medications in total. The doctor looked at that list and said something that changed everything. "I think your medications are stealing your memory. Here's what almost nobody tells you. Many common medications, drugs that millions of seniors take every single day, have what's called anticholinergic effects. Now that's a big word, but stay with me because this is crucial. Acetylcholine is a neurotransmitter in your brain. It's essential for memory, learning, attention, and muscle control. Anticholinergic medications block this neurotransmitter. They literally interfere with your brain's ability to function properly. And we're not talking about rare drugs here. We're talking about medications you probably have in your medicine cabinet right now. Certain antihistamines like Benadryl, sleep aids like Tylenol PM or Unisom, medications for overactive bladder, some antidepressants, muscle relaxants, even some medications for nausea and dizziness. The list goes on and on. When you take one of these medications, you might not notice much. Your brain can usually compensate. But here's the problem. Most people over 60 aren't taking just one medication. They're taking multiple medications, and several of them might have anticholinergic effects. When you combine them, the effects multiply. Your brain is being hit from multiple directions, and suddenly you can't remember things. You feel foggy. You might feel dizzy or confused. Your balance might be off. And here's what's terrifying. Long-term studies have shown that people who take these anticholinergic medications for years have a significantly higher risk of developing dementia. We're talking about a 30 to 50% increased risk. These aren't small numbers. This is your brain we're talking about. Your memories, your independence, your identity. But cognitive decline isn't the only side effect doctors rarely warn seniors about. Let's talk about something even more dangerous. Falls. Every year, 1 in 4 Americans over 65 falls. Falls are the leading cause of injury and death in older adults. And medication side effects are one of the biggest risk factors. Think about it. Blood pressure medications can cause dizziness, especially when you stand up quickly. Anti-anxiety medications and sleep aids slow your reflexes and affect your balance. Diabetes medications can cause blood sugar to drop too low, making you lightheaded. Pain medications affect your coordination. Diuretics make you need to rush to the bathroom, often in the middle of the night when it's dark. Your doctor prescribes these medications to help you, to lower your blood pressure, to help you sleep, to manage your pain. But they rarely sit you down and say, by the way, these medications significantly increase your risk of falling. And a fall at 65 or 70 isn't like a fall when you were younger. A fall can mean a broken hip, months of recovery, loss of independence, or worse. Here's another side effect that's almost never discussed: nutrient depletion. Certain medications literally drain essential vitamins and minerals from your body. Statins, which millions of people take for cholesterol, deplete your body of coenzyme Q10. This is a nutrient that's absolutely critical for energy production in every cell of your body, especially your heart and muscles. That's why so many people on statins complain of muscle pain and fatigue. Their cells are literally being starved of the energy they need to function. Metformin, a common diabetes medication, depletes vitamin B12. B12 is essential for nerve function, red blood cell production, and DNA synthesis. Without enough B12, you can develop numbness and tingling in your hands and feet, severe fatigue, memory problems, even irreversible nerve damage. And most doctors never check your B12 levels or suggest supplementation when they prescribe metformin. Proton pump inhibitors, those little purple pills that millions of people take for acid reflux and heartburn, they block acid in your stomach. But you need stomach acid to absorb minerals like magnesium, calcium, iron, and vitamin B12. People who take these medications for years can develop severe mineral deficiencies. Low magnesium causes muscle cramps, irregular heartbeat, and poor sleep. Low calcium increases your risk of osteoporosis and fractures. And again, most doctors never mention this when they write the prescription. Blood pressure medications called diuretics, water pills, they make you urinate more. And when you urinate more, you lose potassium, magnesium, and other essential electrolytes. Low potassium can cause dangerous heart rhythm problems. It can cause muscle weakness and fatigue. It can even lead to life-threatening complications. But how many doctors tell you to monitor your potassium levels or eat more potassium-rich foods when they prescribe a diuretic? Let me tell you about another side effect that's destroying quality of life for millions of seniors. Sexual dysfunction. This is something people are embarrassed to talk about, but it's real and it matters. Many blood pressure medications cause erectile dysfunction in men. Antidepressants can kill libido in both men and women and make it difficult or impossible to reach orgasm. Some medications for enlarged prostate cause sexual side effects. Even medications for hair loss can cause persistent sexual problems. And doctors rarely bring this up. They write the prescription, you start taking it, and a few weeks or months later, you notice something's changed. But you're too embarrassed to mention it. Or maybe you mention it and your doctor brushes it off, says it's just aging. But it's not just aging. It's the medication. And there are often alternatives or solutions, but only if you know to ask and advocate for yourself. Here's something else that should concern you. Polypharmacy. That's the medical term for taking multiple medications at the same time. And it's incredibly common in people over 60. Studies show that the average person over 65 takes 4 to 5 prescription medications. Many take even more. And here's the problem. Most medications are tested individually. They're tested on their own to see if they work and what side effects they cause. But they're rarely tested in combination with multiple other drugs. So when you're taking 5, 6, 7 medications, nobody really knows how they're all interacting with each other. Your blood pressure pill might interact with your cholesterol medication. Your antidepressant might interact with your pain reliever. These interactions can cause unexpected side effects. They can make medications less effective, or they can even become dangerous. And as you add more medications, the risk of harmful interactions grows exponentially. It's not a simple addition. With 2 medications, there's 1 possible interaction. With 5 medications, there are 10 possible interactions. With 7 medications, there are 21 possible interactions. Your doctor can't possibly keep track of all of these, especially if you're seeing multiple specialists, who are each prescribing different things. Let me tell you about something called the prescribing cascade. This is when a medication causes a side effect, and instead of recognizing it as a side effect, your doctor prescribes another medication to treat it. Let me give you an example. You start taking a medication for high blood pressure. It causes swelling in your ankles. Instead of adjusting or changing your blood pressure medication, your doctor prescribes a diuretic for the swelling. The diuretic causes you to urinate frequently at night. This disrupts your sleep, so your doctor prescribes a sleep medication. The sleep medication makes you groggy during the day and increases your risk of falling. And on it goes. Before you know it, you're taking 5 or 6 medications, when the real solution would have been to address that very first side effect by changing the original blood pressure medication. But this happens all the time. Doctors are busy, they're focused on treating symptoms, and the medical system is set up to prescribe medications, not to reduce them. Here's another side effect that's rarely discussed but affects millions. Depression and mood changes. Many medications can cause or worsen depression. Beta blockers, commonly prescribed for high blood pressure and heart conditions, are known to cause depression in some people. Corticosteroids can cause severe mood swings, anxiety, and depression. Some cholesterol medications affect brain chemistry. Even some antibiotics can cause mood changes. And here's the cruel irony. You start feeling depressed. You don't realize it's your medication causing it. You go to your doctor feeling low, and they prescribe an antidepressant. Now you're taking another medication with its own side effects, when the solution might have been to change the medication that was causing the depression in the first place. Let's talk about something that affects your daily comfort and quality of life. Dry mouth. It sounds minor, but chronic dry mouth is miserable and it can lead to serious dental problems. Hundreds of medications cause dry mouth as a side effect. Antihistamines, decongestants, blood pressure medications, antidepressants, medications for overactive bladder, pain medications. The list is endless. When your mouth is chronically dry, you're at much higher risk for cavities, gum disease, mouth infections, and difficulty swallowing. You might have trouble tasting food. Eating becomes less enjoyable. Your quality of life decreases. And most doctors never warn you about this or suggest ways to manage it. Here's what you need to understand. I'm not saying medications are bad or that you should stop taking them. Many medications are life-saving and necessary. But you have the right to informed consent. You have the right to know what these medications might do to you beyond just treating your condition. You have the right to weigh the benefits against the risks. And you have the right to explore alternatives when appropriate. The problem is that modern medicine has become incredibly specialized and fragmented. You see one doctor for your heart, another for your diabetes, another for your arthritis. Each one prescribes medications in their area of expertise. But nobody's looking at the big picture. Nobody's looking at you as a whole person and asking, are all of these medications really necessary? Are the benefits outweighing the side effects? Is there a better way? Here's what I want you to do. Make a list of every medication you're taking, including over-the-counter drugs and supplements. Everything. Next to each one, write down why you're taking it. When did you start? Do you know if it's still necessary? Then make an appointment with your primary care doctor and bring that list. Ask about each medication. Ask if it's still needed. Ask about side effects. Ask about alternatives. Ask if any of them could be reduced or eliminated. This isn't about being difficult or questioning your doctor's expertise. This is about being an active participant in your own healthcare. The squeaky wheel gets the grease. The informed patient gets better care. If your doctor dismisses your concerns or refuses to discuss your medications, find a new doctor. You deserve a healthcare provider who listens to you and treats you as a partner. Consider asking for a medication review with a clinical pharmacist. Pharmacists are experts in how drugs work and interact. They can often spot problems that doctors miss. Many pharmacies and healthcare systems offer this service, sometimes for free. Be especially cautious about medications that are meant to be short-term but have turned into long-term. Proton pump inhibitors were designed to be taken for a few weeks, yet people take them for years. Sleep medications are meant for short-term use, but people take them indefinitely. These long-term uses increase side effect risks dramatically. Here's the bottom line. Your fatigue, your memory problems, your dizziness, your falls, your depression, your sexual dysfunction, they might not be inevitable parts of aging. They might be side effects of your medications. Side effects that your doctors rarely warn you about, because they're focused on treating your conditions, not on the subtle ways these medications might be stealing your quality of life. You are not powerless. You have more control than you think. Question everything. Advocate for yourself. And never, ever accept that feeling terrible is just part of getting older. Sometimes the cure is worse than the disease, and you deserve to know the difference.